Well, I think the bigger thing is that our bodies are these incredible machines of great abilities to heal themselves, and we just don't allow for the assistance of that. Like we're just really quick to turn it off and take a pill, which potentiate more issues and more side effects. And so I think if we fed our body in the right way, which is herbal medicine, then it would open up a window and an opportunity for the body to do what it does best. I'm Sumayah, and I've been working with herbal medicine, food as medicine for the better part of a decade plus. I feel like I kind of got into it just based in this eye-opening reality that we've been lied to about our food industry, about the amount of antibiotics and steroids that are put into our meat products and such. It kind of tossed me through a loop of wanting to know more about what that looked like. And then I started finding herbs as food being such good health benefits for us, and kind of resolving some of this like medical pharmaceutical use of products. And so then that kind of was just the rabbit hole that took me down this road. And so probably for the better part of a decade, I was just really into sharing herbal medicine, playing with herbs. I've worked on farms, I've traveled, I've worked with first aid with people, but then I got into a program just to further and deepen my studies, and was kind of slingshot into clinical herbalism. Wow. It was not like my reach and goal. It was just a matter of fact that was what was handed to me. And so I kind of just took it. I was like, if this was like, here you go, this is what you're gonna do. And so I rode the wave, and here I am. I've studied Western herbalism and Chinese herbal medicine. I've studied the Chinese diagnostic system. I think that it's amazing. We're talking about 5,000 years of documented information. And the Western side of that, our information, we were kind of burning witches, which were our herbalists, and burning books. So we lost a lot of our traditions and history. And so it's been kind of like climbing the ladder back up out of that to re-navigate what Western looks like, where the Chinese really held their medicine sacred. And there are books and books and books of classical Chinese documents with herbal medicine. And I think that the medical field as a whole has acknowledged Chinese herbal medicine because of their history of recording all of it. So that for me is beneficial, because it's not like a magical thing. It's scientifically proven, and for them to acknowledge it makes it even more valid than to say that we're just kind of like, conspiracy theorists or aloof hippies, Woo-woo, yeah. Right. They don't sit there and attach themselves to a name of like, oh, well, you have like cardiac issues or diabetes, or, there's no like, this is what I have. There's an imbalance in the body. There's an imbalance of the yin and the yang, and there's imbalance of the organ systems. And the way that they look at them are a little bit on a metaphysical side. It's not to say that your heart's not functioning, but we could say that it's maybe not functioning up to where it needs to be. Like when they say blood deficiency, and it's not to say that you're a pint low. It's just to say that the quality of your blood isn't as good as it could be. And so then we would nourish the blood, and we would nourish the organs that create the blood. And so the idea is really treat what you see. So if I'm looking at somebody and I see that they're dry, I'm going to be like, okay, well, here's some herbs that will be moistening. And so I don't have to sit and go by a diagnosis from a doctor to say that there's something wrong here. I could just say, well, there's something going on in the digestive tract, because I could see it in the tongue, I could feel it in the pulse, and I could see it in overall quality of their skin, the texture of their hair, and just their emotional state of being. And so there's all of these, it's just like an elemental aspect, I guess, to like, there's wet, there's dry, there's there's tight, there's lax. So we look at all of these as ways of understanding how the body is functioning and where the imbalance is. So it's just like if somebody has too much dampness, like milk, dairy products create damp, sugar creates damp. The whole of the United States diet is damp. So it's like a pretty common issue that we have. So what we want to do is we want to drain the damp and dry it, like drain it and dry it. And that way it brings the organ systems back to their function where they should be, and then allowing them to do what they're supposed to be doing naturally. And so like the liver, for example, is the most miraculous organ in our body. It heals itself like on a regular basis, right? And so for somebody who has something wrong with the liver, it's like, well, this is the one organ that can heal itself. Like that's what it does. Like it takes all of your toxins and everything that you give it and filters it out of the body. And so it has to consistently reproduce itself. And so if it's not functioning, then it's not going to be able to reproduce itself. Therefore, it's not going to be able to take the toxins out of your body. Therefore, you're going to be full of toxin. Now we're having a problem. Now you're getting all of these other issues because of that one little imbalance in the body. Well, Western herbs are probably primarily what we'll find in the United States and like Western Europe. That would be what we would consider Western, and then Chinese being the herbs we would find there. There's a lot of crossover, and the Chinese tend to use different parts. There's a lot more roots and minerals that they use. They'll use rocks, they'll use shells, they use roots, they use bones, they use like roaches, like the stuff that we use in Chinese is out of this world. Not that I use all of that, but it's wild. But I have never had to use, like I don't have anything in my Western herbal medica where I'm using like a scorpion. But in my Chinese medica, we totally use scorpion, which, I'm like, Right. So I think because of the depth that the Chinese have, they've just used so much over 5,000 years that they just have it to back it up. I mean, who knows what Western medicine could have had? We've lost it all. So I think it's been a long time running. I think, and also Western might be a little bit more rooted in like Greek medicine, which I'm not that familiar with, but I think that there's a lot more in that aspect. Our perception of the word medicine is skewed, and we mix it up with what pharmaceuticals are. Like the word drug, for example. To put drug on cannabis is not correct, because drug is something that is artificial and created in a lab, and cannabis is a plant that has been proven and used to be in medicas like if you looked maybe prior to the 30s, I think, it was in the pharmacies, and being used, and then it was propaganda. So I think there's some level of just a skewed perception of what medicine is. And our food is our medicine, as in what we have in our pantry should be sufficient to helping us digest food. A lot of the herbs that are used in your typical kitchen spice cabinet are carmitatives, which are actually helping you digest food. So when you use curry, like Indian food has probably the best perception of what that looks like, and using herbs as medicine in the food is something like curry, and having cumin or turmeric, even cinnamon, cardamom. These are all carmitatives. They all help the body digest food, especially meat products. And so just that alone is helping your body do its function better. So in eating meat, you could say, oh, well, meat's hard on the stomach. It's hard for the digestive system to digest it right. So you shouldn't eat meat. Well, if you were eating meat and you were eating the right carmitatives with that and the right bitters with that, it would have no problem digesting it at all. So that's kind of, I think, if you can go back to your grandma's food and what your grandma would have given you for something, if you had a bellyache, she would have given you some ginger ale, which used to, in that time, be made with ginger. So if you had a bellyache and you were nauseous and you had some ginger ale, it would actually be ginger that you were drinking, which would make the nausea go away. And so I think that we've lost what that looks like, because now ginger ale is high fructose corn syrup and water and maybe some food coloring. So.
But we have you to reverse the course.
There's an army of us, I promise you, it's happening. So you can find real ginger ale in the stores, and it's spicy, it's delicious. Yeah.
Oh, good to know.
Yeah.
That.
Mm-hmm.
So here at Utopia, there are patients walking through the door that happen to have cancer, and you're incorporating herbs. How many herbs do you have available, like in your tool bag, like in your tool chest, that you might be able to incorporate, with someone?
In my home apothecary, I have 250 herbs that I use. I use loose leaf or loose herbs to make teas with, or poultices with, and I have granules, which are herbal concentrates, that I like to use here because I have a short amount of time, and it's the most accessibly compliant way to take it, because they don't have to do anything extra. They could just take the granules, put it in hot water, mix it, and they automatically have a tea. So that is nice. So I have kind of like a mixture of both. And then I also have tinctures that I use as well if I have to make something custom with a tincture. So
you used a word a minute ago. You said poultice. Explain to us, what is a poultice?
So a poultice is taking herbs, I grind the herbs to a powder. We add some water to it just to make like a paste. And then you can put that on topically so that the herbs are actually penetrating through the skin. And so we would do this for wound care. I also do this for topical applications to palpable masses. The best way to get to wherever we're getting to it is to put the herbs directly on the site. Whatever that might look like. If you have a wound, you want to put it right on the wound, and it's going to heal the wound. And so if you have a mass, then we would put that right on the mass. And I put herbs in there that will actually help potentiate the penetration through the skin. So,
what are some of the most interesting things you've seen with the patients here using herbs, however you're administering? What is just interesting things that you'd be like, wow.
Well, Doc's pretty cool about doing weird stuff, so I don't know, like he does bladder infusions. Yeah, there's an effort here for sure. Yeah. But what's nice is that, like, if I have a classic, let's just say like I have a classic imbalance, there in Chinese medicine we have formulas that are already created for us that have been used over and over and over. And so when there's somebody that presents classically, and I use a classic formula for it, and then I see results, I get super excited because I know it's the formula.
For people like at home, how much should they be incorporating some form of herbs and spices into their daily routines?
Every day.
Just are there some go-tos you would recommend as an herbalist that you would say, you know what? Is it just a go-to? If you could incorporate into your daily diet or routine every day, just one or two, whatever.
Some of them are just pretty classic, like garlic, thyme, turmeric. I think cumin is one that's not given enough notoriety. I mean, it's like in every curry dish ever, but there's actually been some studies done that against water with fluoride in it. Anyway, they did it against three backs up, and it showed that the cumin took the fluoride out of the body. And out of the, even with people drinking the fluoride with the water. So I don't know. Yeah, it was pretty awesome that, it's a pretty phenomenal one. I think that it's a little rough.
Yeah.
Cumin is intense.
Good stuff.
But it's good. I mean, I think the most intense herbs are the best ones. So, yeah. To be open-minded, I mean, I feel that most people have probably used herbs throughout their life, just in food in general. If you've used garlic powder, you've used herbs, and garlic powder is, antiseptic, antifungal, and everything. Mm-hmm. And so I think that we look at herbs kind of like they're our kitchen cabinet, but I think that there's just a deeper understanding that they have a greater function on our body if we just listen to them. Yeah, I don't really know.
That's good.
Yeah.
Good. Thank you. Thank you for taking the time to explain some of this to us, because people need to hear it.
Yeah.
You need to know, right? It's just about raising awareness, right? Hey, there's other options out there.
Yeah, and I think the only other side of that is that most pharmaceuticals are based on plants. We can really lay a foundation if you look at not everything, but most of it. I mean, think like just penicillin is a really great example. I mean, penicillin is a bacteria fungus that was growing on bread. I mean, that's kind of like, I think a lot of people understand that because it's kind of like in a joke, but it's matter of fact. Like, it's literally was derived from fungus on a bread. So
Yeah.
Tylenol is based on white willow bark. It's an interesting just dynamic if you really like research some of our most common things. Like cough syrup is cherry bark, so it's just if you just kind of like look at it that way, that all of the pharmaceuticals that people take, like you can go into the herbal world and find the basis of where it came from.